I'm Dr. Lindsay Remy, and I'm a sports orthopedic surgeon. I treat a variety of different bone and joint complaints, including tendonitis and arthritis and things that often don't have a gold standard surgical approach. Often people are trying to avoid surgery if at all possible and help their body heal naturally when there's an option to do so. And I wanted to spend a couple minutes talking to you today about Platelet Rich Plasma, which is an injection option that I think fits a nice spot in our treatment algorithm to help people who are trying to heal. So Platelet Rich Plasma is a blood-derived growth factor injection. Your own blood is taken out by a nurse or a phlebotomist, and it's separated with a centrifuge to get just the plasma layer that's full of platelets. Platelets have growth factors in them. So when you cut your skin and you form a clot and then your skin starts to regenerate, it's because of the growth factors in those platelets. So they start this healing cascade. Well, in the body, when we inject PRP back into somebody, unfortunately, it can't undo the effects of age and arthritis, but it can help bring some healing to that area in different ways, depending on what exactly we're treating. So one example that I use it for is rotator cuff tendonitis. So some people just have a rotator cuff that's getting worn and inflamed, and with age, maybe there's some partial tears, and there's not much to do for that surgically. Physical therapy sometimes fixes it. Sometimes people come into my office and they still have pain after therapy, and maybe they're afraid to do a cortisone injection because they've heard that cortisone can weaken the rotator cuff, which is unfortunately true, and they wonder what else there is that we could do. Well, platelet-rich plasma fits in very nicely in that area because it brings in growth factors that reduce inflammation, and sometimes with that reduction in inflammation, people's pain goes away, and sometimes that's enough to allow their shoulder to function normally, their biomechanics to improve, their posture to improve, and then the body can heal that area of damage. There have been a couple randomized control trials recently that have come out comparing cortisone injections to platelet-rich plasma injections for rotator cuff tendonitis or subacromial bursitis, which is a related condition, showing that there is equivalent levels of pain relief without the risk of the rotator cuff weakening that happens with cortisone, and potentially even lasting longer with the platelet-rich plasma. So I think this is a very good option for people. The other area of my practice that I think platelet-rich plasma can help a lot is with knee osteoarthritis. So many of my patients aren't yet ready to have a full knee replacement because that's a very big commitment, or they're in a situation where they need to optimize their health before they can safely have a knee replacement. They need to lose weight, they need to get their blood pressure under control, or they need to control their diabetes before they have a major elective surgery, but they need some pain relief because the other treatments that they've tried have not been working. Well, PRP injections have been wonderful for pain relief for my patients, and that is borne out in the scientific literature as well, with randomized control trials coming out showing that PRP is superior to cortisone or hyaluronic acid injections on average at the 6, 9, and 12-month marks after the injection. Early on, people do well with any injection, but the PRP seems to last longer, and that's what I'm seeing in clinical practice as well. Sometimes PRP gets added to a surgical repair as well. So there are times when I'm doing a tendon to bone repair, for example, an Achilles tendon rupture or a rotator cuff tear, and tendons are just slow to heal. And so some patients will tell me, hey, Dr. Remy, is there anything else you could do that you think might make my body want to heal this more? And I'll say, yeah, the literature on this is mixed, but there are some studies showing that adding platelet-rich plasma concentration injected at the site of a tendon repair may encourage that tissue to heal a little bit more reliably. So if that's something that you're wondering about, I can talk to you for your specific surgery, what the specific scientific literature is in that area. There are 3 additional things that I think you need to know about platelet-rich plasma. One is that at the time I'm recording this video, it is not currently covered by insurance plans. I do think that's going to change in the years to come because more and more studies are being published showing its efficacy. But for right now, this is something you'd be paying for out of pocket. Number 2 is that results vary. I can't guarantee any treatment for any one person. So while I'm happy to give you my expert opinion on if I think it's worth you trying it, I don't actually know if you're going to get full pain relief for your problem. And number 3 is that the timeline varies. So some people get pain relief very quickly, particularly when we use it for knee osteoarthritis. Most people are getting benefit within a couple weeks. But other times it can take several weeks to get full pain relief, especially when we're using PRP into a tendon. We need time for the body to mend that tendon afterward. So it's more of a 6 to 8 week process healing. Also with the tendons, there's some physical therapy involved to have the maximum benefit because you really want to treat your body holistically. We want to bring in the growth factors, but we also want you to change the way your joints and your muscles are moving around it. So physical therapy is an excellent tool to help in that. I hope this video answers your questions about platelet-rich plasma. If you have any additional questions, please feel free to reach out to me. Bye-bye.